There's two types of people. People whose faces get red when they drink and people whose faces don't get red when they drink. So, certified dermatologist Billy Groff is here from Laser. What is the name of your place again? I go there all the time, and it's like a Cosmetic Laser Dermatology at UTC. Yeah. Right. Either you get a red face when you drink, or you don't get a red face when you drink.
Right.
So, what is that red? Is that rosacea that you get?
It can be. We've known for years that alcohol makes rosacea worse, but what came out just in the last few weeks was a study that looked at 80,000 women and showed that women who drink white wine or hard liquor, it can actually cause rosacea.
80,000 people in that sample? That's a lot.
So it was a really good study.
It was a causation,
so
not
it's
a correlation.
causation. For years, we didn't really know what caused it. We knew alcohol made it worse.
But it causes
it. It can cause it, yeah.
Let's look at some pictures. So there is a treatment for this, right?
Right.
You're talking
well,
about you do
there's
it at your
topical
office.
therapy. There's a medication like antibiotics, for example, you can use to treat rosacea. But if you have the redness and the flushing, the only way to get rid of it permanently or for long term is to use lasers, and that's what I'm doing in the video there. Usually with one laser treatment, I like to use the best laser is what's called the VBeam Perfecta. And with that laser, with one treatment, I can get somewhere between 50 to 70% improvement.
Does it hurt?
It feels like a rubber band snapping on the skin, but you're tough, so you can handle it.
Famous
Although
last
you don't
words.
need it, so.
So you can put some numbing stuff on there, though,
yeah,
right?
sure. We always use numbing cream. We try to be nice to our patients.
You don't have this like sixth sense of like hurting people.
No.
What exactly is rosacea? I don't really get it. Is it a rash or is it a color?
We can think of it as a rash, but it's a chronic kind of inflammatory skin disease that starts usually after the age of 30.
Oh.
And it actually affects women more than men, but men, when they get it, tend to have worse cases. So what it manifests is redness, broken capillaries. You can get a lot of acne bumps.
Oh.
So and then oftentimes patients feel like they're red or flushing, particularly when they exercise, when they drink alcohol, if they eat spicy foods,
What are the other options? Are there some topicals? You said there were some topicals.
There are some topicals which can help with the acne portion of it, but they don't really help with the redness, and they really don't help at all with the broken capillaries. So for that, you have to use that laser that we discussed.
So the patients who come into your office, what is the complaint? So what? They have broken capillaries and some flushy in the face. Like, who cares?
It can look really,
what do they say? That like people notice or something?
Well, they can say that it's embarrassing because their face gets, if they have even one glass of wine, they get really flushed and it looks really patchy and mottled. And also burns and stings a lot of patients. And some patients from rosacea actually even get some swelling in the face. So
it burns. Is it just on the face or is it anywhere else on the body?
It's most likely on the face, but you can actually get on the neck and chest as well.
Is it? Well, could it just be nerves? I mean, or because it's like alcohol or just stress, or what causes it?
Alcohol does have histamine in it, so sometimes certain patients who drink alcohol can get like this alcohol rash temporarily, just for an hour or two.
Yeah. So it's this is an inflammation thing.
Right.
So do you also talk to your patients about maybe diet or anything like that, or is that another doctor?
Diet. So you want to avoid, of course, alcohol.
Oh yeah, you got to avoid the alcohol. So that's
possible.
Get the laser.
4th of July coming up.
Or you could drink, get the laser. Drink, get the laser.
That's right. Hot and spicy foods like hot chicken wings, or say a hot cup of coffee. You want to stay away from saunas, hot tubs, things like that. Will all make it worse.
So you can start that after the 4th of July, or just go see Dr. Groff in his office. So thank you for being here. A lot of people. This is either you get red or you don't get red, guys. That wraps it up for us. I'm going to send it back to you.